Good evening, listeners. Good evening to you. Okay, I'm the chair of the Wandsworth LGBT Forum. Wandsworth and Lambeth have not just one of the highest rates of new HIV infections in London, not the UK, but Europe. Yet this week, Public Health England decided to not prescribe PrEP as an effective measure to control HIV. Do the panel agree with this decision? And I just want to highlight that HIV is not just a gay man's disease, it can be anyone here in the crowd tonight.
For your question, look, there's no doubt about it, HIV/AIDS is one of the largest global health issues of the last 50 years. I've worked in Africa for a number of years with patients with HIV and AIDS, and I've worked in London with so many patients, and the incidence is going up. Any medication to mitigate the spread of the virus should be welcomed, as long as there's some very important considerations. Firstly, how safe is it? There have to be long-term studies that show that this is safe for the patient. And also, we need to make sure that any money spent on PrEP would not be money taken away from research into a cure, because ultimately we need to cure the HIV virus and AIDS. And we need to make sure that other STIs that could still be transmitted are targeted through education programs. And I look forward to working with Wandsworth LGBT Forum together to come up with looking at innovative ways to make sure that safe, healthy relationships within our gay, straight, trans communities, bisexual communities are all supported, so we can all live together safely and we can tackle HIV/AIDS as the global epidemic that it is.
Esther.
In the school that I work in, I'll just give you a bit of background, some of the students formed a club called We Are, and it was a club that came out of Stonewall, and they have educated the students, they've educated us teachers about LGBT issues and sexual relationships, healthy sexual relationships. And it saddens me that a government does not see a problem like this and think that it's worth funding. My sister works for the UN, and her speciality is HIV and AIDS. And I spent some time in Africa, around the west coast of Africa. As you go from Morocco all the way down to Cape Town, you see the devastation that HIV and AIDS has had. And as Rosanna said, that it's devastating some communities here in London too, and they need our support, and they need to be championed.
Thank you, Esther. Dan Watkins.
So David, thank you for raising it, because actually a lot of people think HIV rates are dropping, so you raise a very good point. Education is part of the solution, and obviously I've been working with LGBT and other community groups for a number of years now. The work Wandsworth LGBT does is fantastic, we should say that, working in mental health, supporting families, parents, and educating, as we say, on sexual health. And in fact, the future plan for a community hub for the LGBT community on one of our high streets, I think, is a really good idea. It stands exactly in line with the work I've been doing with health workshops in the community, and as I said earlier, I want to see more of. On the specific question of PrEP, I think it's one of those where it's quite early days for the drug, and actually, as I understand, £2 million has been committed for research into the topic, into trials on the drug. And I would just say, I think it's right that we see the trials reach conclusion, and then if they are entirely positive, then we have a discussion, then we fight for the budget. You know, if it's working and there are no side effects, then absolutely, I think it has to be part of our arsenal to fight HIV.
Thank you, Darren. Elizabeth Jones, a minute and a half.
I think that's the most excellent question, because one thing that I have noticed, and I think could be a really good cheap hit here, there is simply no public information anywhere. I'm sure we remember about 30 years ago, the big poster campaigns, and they're quite cheap to run. I think it would be a very, very good idea if we started running in Tooting some poster campaigns just highlighting and making people aware that HIV is out there. No, I'm sorry, but I don't mean it is out there across all sectors of society. And one thing that I think is very, very important is that women need to understand the importance of PrEP. You could have a situation, you're a woman, go off, have a one-night stand, whatever, worried about pregnancy, worried about chlamydia, and you don't give HIV a thought. PrEP is vitally important, provided it doesn't cause any damage, or it's not going to cause any long-term damage, people. Very, very important. It's a far cheaper hit to give someone PrEP than have to go through the dreadful worry of having to have HIV medicine. But I think we should start with public health posters. There just isn't anything out there anymore. It should be rolled out throughout the whole of London. Why aren't there any public health posters warning people of HIV? It's not going to go away.
Thank you, Elizabeth. And last, Alex Glassborough.
I think you're absolutely right to test the reasons for the refusal of this drug. I wouldn't seek to add anything to what people more medically specialised than me would say. I would just mention this. Esther mentioned South Africa because this raises the interesting question within the NHS of the costing of trademark drugs, because you'll be aware that the Constitutional Court in South Africa allowed antiretroviral drugs to be provided on a non-trademark basis. And if my recollection is correct, I think they're made in Cuba. And that, of course, that has a massive effect on availability, and it has a massive effect also on the point that I raised about NHS funding generally, because the pharmaceutical bill is a huge part of that. Another example of that, for example, and I forget which pharmaceutical company it was, but of course there was recently a free provision of an anti-malarial drug as well. So there are precedents. As to your particular case that you raised of this drug, I think you're absolutely right to test rigorously for reasons for it not being used now.